Hi dears, I am Dr. Rajendra Kumar, PhD in Audiology and Speech Language Pathology with 18 years experience in diagnosing speech language pathological issues and also hearing related issues. Today, 22nd October is known to be International Stuttering Awareness Day, and the theme of this year in 2025 is a diverse stuttering community meeting challenges with strength. So before going into the tips, let us focus on few things about stuttering. So first, stuttering is also known as stammering, and it is more common in children, around 8%, than adults, only 1%. But around the world, 70 million people are suffering with this stuttering. So in developmental pattern from birth to what we call childhood age, around 3 to 5 years, there is a normal pattern of normal non-fluency, means the children try to imitate the adult speech and they tend to get this stuttering, and that is normal in that period, 3 to 5 years age. But if it prolongs that age, then it is characterized as stuttering, developmental stuttering and learned stuttering, etc. So now, how do we diagnose stuttering? See how to what we call assess the stuttering. The assessment and evaluation of stuttering is done by speech language pathologist. So speech language pathologist, he takes a sample of total words, around probably 3 to 5 paragraphs, and he will assess the disfluencies. The disfluencies are like prolongations, pauses, hesitations, and repetitions. In this, he will categorize how many types of disfluencies he is able to notice from the speech sample of the client. So accordingly, he will make the what we call severity of his problem, his client's problem. So once the sample is taken, the severity of stuttering is known. When 0 to 3% is there, it is known to be normal. Above 3% of disfluencies in a speech by a client or anyone is known to be mild up to 5%. 3 to 5% it is known as mild stuttering, 3 to 7% also, and 7 to 15% it is known to be moderate stuttering, and 15 and above percentage is known to be stuttering at severe level. Okay, so once he means speech language pathologist diagnose the problem, he will counsel the client regarding the causation or how the stuttering is developed. Generally, stuttering has various causes, but in general, some contact with any stutterer may also get stuttering features in the client. So that we have to rule out, and also we have to rule out any other like situational fear or phobia or stage fear or gender what we call speaking with opposite gender people, or during situations or when they are speaking with elder people. How and when they are getting stuttering, we need to notify and we have to counsel the client. So after the counseling, the speech therapist means he will give fluency therapy. So in fluency therapy, he will start with few basic tips. Okay, and those tips are very much helpful. So today I will try to tell you few tips. So initially, after the evaluation is done, speech language pathologist, he will counsel the patient that the patient has to only speak with his intentions to communicate only. So when the communication from his part is done, the communication means and needs is done from his side. So he no need to worry about the situation, about the what we call circumstances, etc. So before going into tips, again we counsel the patient about the positive motivation to the client. So we give lots of positive motivation, and we make him confident while speaking with giving him so many examples how to face the situation, how to be prepared, and what are our lacunas, how we need to reduce those errors from our side, and how we need to practice daily, and how to improve our speech and also our personality. This way we will counsel in a positive way. So once the psychologically this client is prepared, what we do is we give him first is through breathing. So breathing is very much important, and breathing need to be started with deep breathe inside. We need to take deep breath, and we need to relax, release the air. So while we are doing inspiration and expiration, the relaxation is obtained. So but in the same simultaneously, what we have to do is we have to take lots of breath, and we have to expel the breath slowly. So while doing this, there is a pattern. So say there is a diaphragmatic breathing. Diaphragmatic breathing means one has to breathe through stomach here, and he has to put his hand here, and he has to feel that he is taking total breath inside into the stomach, then to the clavicles or chest. So chest breathing need to be avoided, and we have to advise and suggest the patient to take abdominal breathing. So like this you can do. So this way we need to do lots of diaphragmatic breathing exercise, and we have to counsel the patient to do minimum 5 to 10 minutes initially. Then what we suggest is we ask him to prolong the speech. For example, he is speaking with lots of effort, or with shallow breathing or short breathing. So we will correct it. We will suggest him to take breath, and he has to say, my name is Dr. Rajendra. So take the breath, and while expiration, while expelling the air, while taking out the air, he has to continuously, with soft voice, he has to prolong the speech. So this way it will help the patient who stutter to correct themselves very much. Okay, and also try to prolong here the vowels. Okay, my name is Rajendra Kumar. This one we can do. Okay, so after doing this, again we can take few more exercises like nasal humming. Okay, so this one will also help in prolonging the speech. So while taking breath in general in calm situation, what we do is we just take breath and we expel the air in general, but 1:1 ratio, or 1:1.5 ratio, or 1:2 ratio. But when it comes to, so nasal humming helps in prolonging the speech, and also what we do is when we practice the speech we will speak in a softer voice. So if any queries you can contact me on my number. I am from Hyderabad and 9849236299 from India. So I am that. Don't worry about the stuttering. Everybody stutters during their situation, in interviews, in situations such as where we tend to feel tense. That is common, but if it exaggerates, if it becomes more intense, then we need to take help of speech language pathologist for fluency shaping and therapy. Okay, so once again I request you, in this stammering will only reduce, its severity will decrease with the help of therapy, but complete cure is not there. So if you are reducing the severity of stuttering or stammering, automatically it falls into normal. So below 3% anything is normal. So no need to worry, just focus and learn from speech language pathologist, attend good fluency therapy and get rid of your stammering problem. Okay, Jai Hind, Dr. Rajendra Kumar signing off.